Hi everyone, welcome to the Leaky Gut Solution. I'm excited to discuss this very important topic of leaky gut with you and provide you with solutions. I'm Teresa Rispoli, Doctor of Clinical Nutrition, acupuncturist, functional nutritionist, and founder of FunctionalNutritionistAcademy.com, where I teach a certification program called Mastering Functional Nutrition. And I'm the founder of Complete Health Institute, located in Agoura Hills, California, where I've been in a successful practice for over 27 years. I'm passionate about what I do, and I decided to pay it forward and help you learn the tools and principles of functional medicine and functional nutrition, which I use in my wellness center every day to solve my patients' chronic health conditions. So you might want to get a pad and a pen because you'll want to take notes. Also, if you stay till the end, I'm offering you a very special gift that will give you further understanding of how to solve chronic health conditions naturally. The gut or gastrointestinal system is truly a gateway to overall health or chronic illness. This is my favorite topic because if you can heal the gut, you can heal the most chronic health conditions. The gut microbiome is an ecosystem of organisms, including bacteria, yeast, fungus, viruses, and protozoan, throughout the digestive tract. Far beyond just digestive health, the following organ systems are also closely related to the gut: the immune system, endocrine system, nervous system, circulatory system, integumentary system, respiratory system, and reproductive system. A few key points to consider. There's 10 times the amount of bacteria in our body than our own cells, and the majority of them are found within our digestive system. The gastrointestinal system produces 90% of the body's happy hormone, serotonin. Most importantly, approximately 70% of our immune system is housed in our gut. As you can tell, gut health doesn't just stop at digestion. The health of our gut affects nearly every system in our body. Now, leaky gut is a term that refers to intestinal hyperpermeability and has become an increasingly more common health problem seen today. Leaky gut causes major health problems, including autoimmunity. How, though? Intestinal permeability is exactly what it sounds like. The digestive tract is no longer able to ensure the good guys stay in and the bad guys stay out. Instead, the tight junctions or proteins holding the intestinal wall together are loosened. This leaves sizable gaps for undigested food particles, digestive fluids, and toxins to enter the bloodstream. The body reacts to these foreign particles in the blood by producing immune antibodies or pro-inflammatory cells to fight them off. This breeds chronic inflammation, food allergies, and various health complications, eventually leading to autoimmune disease affecting various body parts. Of course, there are no signs of improvement until the gut's permeability is addressed. Fortunately, we now have a better understanding of the causes, obstacles, and treatment methods for leaky gut, so there is a stop to the cycle. Several factors negatively affect the gut's integrity. These are known as triggers of leaky gut. The most prominent include the standard American diet, exposure to chemicals, chronic infections, gluten and other grains, food allergies, excessive medications, poorly managed stress. Now, the standard American diet, rightfully known as the SAD diet, is one of the leading causes of chronic health issues we see today. According to a 2009 study conducted by the USDA, 63% of calories Americans are consuming came from processed foods containing preservatives, refined grains, and added sugars and oils. It's almost as though the general public took it upon themselves to refigure the food pyramid to consist of grain at the base, dairy in the middle, and sugar at the top, when in all honesty, none of these foods have any business being part of our diets at all. You can call it what you want, food, frankenfoods, food-like substances, fake food, but you most definitely can't call most of our food supply real food. When the majority of our diets are packaged meals with paragraph-long ingredient lists and labels we can't understand, we're not eating real food. Here's a couple of alarming facts. The United States Food and Drug Administration, the FDA, has approved approximately 3,000 different food additives, preservatives, and colorings without adequate research on safety. The average person ingests over 150 pounds of additives each year. The magnitude these chemicals are allowing into our lives is incomprehensible. We're becoming more and more aware of the consequences from this fake food lifestyle, and it's simply unacceptable. This is only one factor in the leaky gut epidemic, but definitely a big one. Up next, we'll discuss other factors responsible for the onset and progression of leaky gut. Inflammation. It's a vital immune response and is the body's attempt to defend itself against pathogens, heal from injury, and repair damaged tissue. Chronic inflammation, however, is not beneficial to our body in any way. In fact, it can worsen the body's ability to recognize foreign invaders and puts the body in a state of stress for extended periods of time. Inflammation can cause leaky gut and lasting damage, increase food allergies, and eventually cause autoimmunity. This type of inflammation can be caused by a number of things, largely poor dietary habits. If chronic inflammation goes untreated, leaky gut is worsened, and the body ultimately loses its ability to repair from the damage. This is called leaky gut syndrome. Gluten is the general term for a mix of proteins in many grains such as wheat, barley, and rye. Gluten has found itself in much of our food supply, disguised in packaged foods and featured in most prepared dishes. It's no surprise that our consumption of gluten has increased immensely, and our health is suffering from it. Gluten allergies, sensitivities, and intolerances are becoming increasingly more common. The term gluten-free has become a buzzword within the health community, and people are finally beginning to explore how dangerous gluten can be for their health. How dangerous is it, you ask? Gluten can cause inflammation in your gut, thus cause leaky gut. Simple as that. Zonulin, a protein found in gluten, increases the permeability of the gut by further opening the spaces between the cells. The antibodies normally released as a result from leaky gut are accompanied by more antibodies created to attack one of the gluten's more prominent building blocks, gliadin. This leads to more inflammation, more body confusion, and more health complications. In other words, your body reacts to the consumption of gluten by creating a defense mechanisms to fight it. Once this damage has occurred within the digestive tract, it is then distributed throughout the entire body. Aside from contributing, if not entirely causing, leaky gut, gluten increases inflammation, overall digestive distress, and alters the balance of our microbiome. Our microbiome must be equipped with efficient, healthy bacteria in order to be successful carrying out its necessary functions. Without the proper balance of bacteria, the following functions are disrupted: digestion, immune response, nutrient absorption, hormone regulation, vitamin production and absorption, detoxification, mood management, and many more. Gluten produces both primary and secondary health effects. The damage gluten causes, which I just explained, are causing the primary effects: intestinal hyperpermeability or leaky gut, permeability of the blood-brain barrier, the onset of autoimmune diseases such as celiac disease, Crohn's, and ulcerative colitis, the development of psychological disorders, dysbiosis or abnormal bacterial growth, acute allergenic or IgE immediate responses, and delayed antibody responses, IgG and IgA. While all of these issues are very serious within themselves, they too cause further complications. Next comes the secondary effects of gluten. The secondary effects of gluten exposure include severe nutrient deficiencies, such as iron and B12, systemic inflammation leading to organ and tissue breakdown. It may seem a bit redundant that I keep coming back to how your body acts on gluten, but it's one of the most important pieces of information you can take from this class. Gluten is a major component in the leaky gut cycle. It is present in the onset, the maintenance, and the progression of this damaging condition, and it should not be taken lightly. As you can probably guess, gluten's path to disease is pretty direct. The first step is when gluten's contributing goes unnoticed. At this point, it's likely that there are little to no known symptoms. This is where most people will assume that gluten won't hurt them, and therefore can eat it with no problem. Unfortunately, the lack of apparent symptoms does not mean that gluten does not hurt your gut. In fact, it takes exposure over time and the accumulation of damage before leaky gut will be noticed. For those cutting out gluten before they feel any physical discomfort, they're still treating an underlying issue even if they can't quite feel it yet. The next step is the progression to subclinical problems. This is where leaky gut truly begins to develop. Often, the first things will be noticed is increased food and environmental allergies. Digestive distress may begin to be more frequent. Unfortunately, it's common for people to still avoid blaming gluten for their discomfort at this point. The last step is recognizing the problem. However, it's not usually recognizing gluten as the problem, but the acknowledgement of the problem that gluten has caused. For example, if someone is diagnosed with a chronic disease or develops inflammatory changes, most medical doctors will begin treating these conditions rather than examining the origin or the root of the problem. It's a shame that this path to disease happens, because if gluten was recognized as the main problem during the early stages, then a lot of these health issues would be avoided entirely. Gluten, however, is not the only concern when it comes to solving leaky gut. We'll be going over other issues that contribute to this dangerous syndrome in a moment. Much like the additives and preservatives flooding our food supply, pesticides are also a big part of what's on our plates. There are 3 million tons of pesticides used worldwide each year, and more than 16,000 chemicals involved in the production of these pesticides. Studies to ensure their safety on humans have been very limited, whereas some have no documentation research at all. While we're not entirely sure of their safety on human health, we do recognize strong links between pesticide exposure and nervous system disorders, immune system suppression, reproductive damage, hormonal imbalances, thyroid issues, type 2 diabetes, obesity, asthma, migraine headaches, attention deficit disorders, and developmental delay in children. The magnitude that pesticides, along with steroids, hormones, antibiotics, and excitotoxins, show up in our food supply is truly frightening, and these add to the triggering effects of leaky gut. Medication is also a triggering factor. Medication is severely overprescribed in current medical model used today. Medical programs train doctors to medicate symptoms, even when they are unsure of the cause. This, in the short term, has seemed to work because the patients experience temporary relief from their discomforts. But what isn't taken into account is how these excessive prescriptions have affected our bodies and our health. For example, statins, drugs used to lower cholesterol, have shown to lower vitamin D and CoQ10 levels. While it may be lowering cholesterol, it's simultaneously causing nutrient deficiencies, muscle fatigue, increased blood pressure, and weakened immunity. Painkillers like ibuprofen, naproxen, and aspirin contribute to vitamin C and iron deficiencies, leaving one vulnerable to disease and eroding the mucosal layer of the stomach lining. Acid reduction medications hinder the digestion of protein, calcium, and vitamin B12, often causing chronic pain problems. Long-term use of antidepressants significantly reduce the gut's motility and cause digestive issues. Lastly, it's important to note that almost all medications are unable to differentiate between the good bacteria in our gut and the illness it's trying to attack. That results in altered microbiome and a much greater risk of infections. As you can tell, drugs offer a lot of unintended consequences that can affect your health very badly. There are a few situations where drugs should be your solution, such as a life-threatening infection or surgical situation. Without the immediate emergency needs of medication, it's always best to treat the issue than it is to temporarily patch the problem. Now, our gut has 5 critical elements or defenses that it truly needs for a healthy gut function in order from the most outer layer of defense, and they include mucosal IgA, otherwise known as immunoglobulin A. This antibody found in the mucous membranes is considered your gut's first line of defense against toxins. Tight junctions, these are small proteins that are responsible for holding the gut cell together. This is what is most directly affected with leaky gut syndrome. Gastro-associated lymphoid tissue, otherwise known as GALT. This is the gut's concentrated immune system, and in fact, 70% of our immune system altogether. This is the gut's last and most powerful layer of defense. The gut's accessory defense includes friendly bacteria. As I mentioned before, we have more bacteria in our body than we do our own cells. This bacteria can communicate with the GALT, warning it of potential danger. Then there's stomach acid. This is absolutely essential for the digestion, absorption of nutrients, and defense against infections. It's actually the first line of defense against infections. If there is any dysfunction throughout your gut's line of defense, these 5 primary barriers need to be evaluated in order to heal and be properly treated. The first step of healing is ruling out the fundamental cause of leaky gut. We always want to get to the root. It's important to recognize that it's very rarely only one cause, but a combination of several causing the damage. You must first rule out or begin to recognize the following: vitamin deficiencies by functional nutrition testing, infectious pathogen by blood and GI tract tests, heavy metal toxicity by urine or hair testing, gluten sensitivity through the HLA-DQ genetic testing, environmental allergies via skin or blood tests. If any of these come back positive, you have your first step of instruction. You'll need to address the deficiencies, implement dietary changes, limit exposure to allergens, and consider detoxification methods to unburden your body from chemicals. Once you have a better understanding of your body's unique needs, you can begin the formal functional medicine protocol, the 4 R's. Here it is. The 4R program is administered to help you heal from digestive distress, reverse gut complications, and rebalance your gastrointestinal microbiome. It is an incredible tool to acknowledge and treat health issues, dysfunctions, imbalances, and personal health needs. The 4R program should be done in the following order. Remove. First, you want to eliminate problem foods, toxins, low-grade infections, and oxidative stress. Then you want to repair. You want to begin reintroducing a clean diet with essential nutrients your body needs to repair. Restore. You want to repopulate your gut with healthy bacteria to restore the proper balance of gut flora. And lastly, you want to replace digestive enzymes, antioxidants, and immune-boosting vitamins to promote a sustainable and healthy digestion. We, as functional medicine practitioners, are trained in this protocol, enthusiastic about making sure your individualized needs are addressed during this process. At this point, you may already have removed things you already knew were to be detrimental to your health, such as gluten, known allergies. But you'll also want to remove much of the chemical burden in your daily life. So this includes pesticides on food, genetically modified foods, unnecessary medications, and chemical household cleaners. Once you have an understanding of what should be removed from your daily life and you have begun to implement those changes, it's time to begin repairing the damage that had previously been done. This is done by calming the chronic inflammation and reintroduction of nutritious foods, digestive enzymes, probiotics, essential fiber, vitamins, minerals, and amino acids to help with repair. For some people, these steps may mean implementing intermittent fasting to help calm down the inflammation first, then supplementation, or personalized diet plans that cater to their specific needs. Someone might be carbohydrate intolerant or FODMAP intolerant, so these things need to be taken into account. That's where we talk about therapeutic diets. Again, be sure to consult with your functional medicine practitioner to be sure you're beginning the most appropriate repair route for your needs. Nutrients must be replaced for effective healing. While everyone's needs are highly individualized, here are some of the most common supplements that have been proven to be helpful in the gut healing process. Probiotics, prebiotics, which is usually fiber and inulin, digestive enzymes, fiber, collagen, turmeric, L-glutamine, quercetin, and resveratrol. These are only suggestions. We are unable to prescribe these supplements to you without comprehensive testing, as everyone's nutritional needs vary. However, a main takeaway from this is that you should not rely solely on supplements. They can be used to help your healing process, but the goal is to be able to sustain wellness with whole foods and healthy lifestyle choices long term, without the need for piles of pills. The most difficult part of healing is maintaining it. Even if you build a strong foundation during the healing process, without the proper diet, lifestyle choices, and stress management, long term, you can fall right back into the same gut-destroying patterns. Remember, health is a journey, not a destination. Although there is plenty of research on the dangers of leaky gut, it is still considered a medical mystery. Many cases go misdiagnosed and in turn not properly treated. It is crucial to work with a doctor familiar with the condition and will perform the appropriate test in order for you to heal effectively and efficiently. For more information and your free gift, please visit functionalnutritionistacademy.com and subscribe to the free report on solving chronic illness today. To book an appointment with Dr. Rispoli, visit CompleteHealthInstitute.com and book an appointment now at the top. Always start with the fundamentals. Honor your body's unique needs and skip the guesswork. Thank you for taking the time to experience this class. We love sharing this topic with people who are eager to transform their health, and this group is just fantastic. If you have any further questions, please post them below, and I'll be happy to address your concerns. Remember, I'm always here for you, to support you. Thank you again for spending time with me. Now I want to hear from you. Please share the most valuable piece of information you learned from Leaky Gut Solution. And I hope that the Leaky Gut Solution exceeded your expectations and that you feel well equipped with the knowledge, resources, and tools to treat leaky gut efficiently and effectively. For more information, remember, visit functionalnutritionistacademy.com. Here you can learn how to become a certified functional nutritionist online in your own time. I urge you to join now and become a leader in your area.